The importance of diet for people with herniated discs. Recurring inflammation and pain associated with herniated discs can be positively affected by a diet that includes anti-inflammatory components and nutrients that promote the production and maintenance of healthy cartilage. Herniated discs often cause severe pain and a range of other uncomfortable symptoms. A proper diet, carefully selecting what to eat and what to avoid, can help manage the condition and reduce its impact on quality of life. In addition to following prescribed medical treatments, maintaining a balanced and appropriate diet during the healing process of a disc injury is crucial. Research has shown that nutrition plays a significant role in spinal health. If you're dealing with a disc injury, knowing which foods to include or avoid can greatly influence your recovery outcomes. A herniated disc typically involves a tear in the annulus fibrosus, which is made up of strong collagen fibers. While inflammation is a natural part of the healing process, it often causes considerable discomfort. Diet plays a key role in supporting the treatment and prevention of herniated discs from becoming more serious. Choosing the right foods not only helps reduce inflammation and strengthen joints and bones, but also aids in spinal recovery. On the other hand, inappropriate foods can increase inflammatory responses, worsen pain, and slow the healing process. Patients need to understand what to eat with a herniated disc in order to build a suitable meal plan that supports effective treatment and recovery. At the same time, avoiding harmful foods is necessary to prevent the condition from worsening. Herniated discs cause significant pain, discomfort, and limitations in daily activities. Cervical, neck, and lumbar lower back disc herniation are among the most common types. Nutrition plays a vital role in the treatment and recovery of spinal function. That's why questions like, "What should I eat if I have a herniated disc?" are of great concern to many patients. In this article, we will explore what to eat and what to avoid with a herniated disc in order to build a healthy, science-backed diet that supports recovery and improves quality of life. What nutrients should people with herniated discs take? Below are some beneficial nutrients and foods for individuals suffering from herniated discs. Patients should consider incorporating these into their daily meals. 1. Vitamin A. Vitamin A is widely known for supporting eye and overall health. However, few people know that it also helps nourish spinal discs by promoting the growth of mature cartilage cells, an essential factor for healthy cartilage and stronger spinal bones. When the discs are damaged, supplementing with vitamin A can accelerate healing and help relieve pain. Rich sources of vitamin A include milk, beef, carrots, pumpkin, and sweet potatoes. However, excessive intake should be avoided. Consuming more than 2,000 milligrams per day may increase the risk of bone fractures. 2. Vitamins. Spinal discs are largely composed of collagen, which plays a vital role in maintaining and repairing damaged discs. Vitamin C is essential for collagen production in the body. Additionally, vitamin C acts as an antioxidant, reducing inflammation, slowing degeneration, and improving the condition of inflamed discs and surrounding tissues. Excellent sources of vitamin C include citrus fruits like lemons, oranges, grapefruits, and red peppers. Vitamin C promotes the formation of collagen, a connective tissue matrix that strengthens bone cell connections. It also works as a powerful anti-inflammatory and antioxidant, helping eliminate inflammatory agents from the body. Therefore, vitamin C supplementation supports spinal health and helps prevent complications such as myelitis, spinal arthritis, and nerve inflammation. To further support healing, it's important to consume antioxidants, which enhance the body's collagen production. Foods rich in antioxidants include artichokes, raspberries, blueberries, dark chocolate, kidney beans, and pecans. Green tea, garlic, and cayenne pepper are also excellent antioxidant sources. 3. Vitamin D. Vitamin D is essential for helping the body absorb and metabolize calcium, which strengthens bones and prevents conditions like osteoporosis and spinal degeneration. A deficiency in this fat-soluble vitamin can increase the risk of bone fragility and worsen disc herniation. People with herniated discs should ensure they get enough vitamin D through daily meals. Good dietary sources include fatty fish, such as sardines and salmon, red meat, eggs, dairy products, and mushrooms, the only plant-based source of vitamin D. However, food alone may not provide sufficient vitamin D. Patients are advised to get regular sunlight exposure, especially during the morning hours and winter months, to ensure optimal absorption. 4. Vitamin K. This nutrient helps regulate calcium distribution in the body and supports bone protein synthesis and mineralization. Vitamin K can be found in whole grain cereals, breads, nuts like cashews and almonds, dark green leafy vegetables such as kale, spinach, and broccoli, as well as in avocados and kiwis. Other sources include animal liver, pork, dairy products, and vegetables like asparagus and spinach. 5. Vitamin B12. Vitamin B12 plays a vital role in the formation of bone cells, red blood cells, and bone marrow. A deficiency can hinder the recovery process from a herniated disc and is directly linked to osteoporosis. To ensure adequate vitamin B12 intake, include milk, eggs, and meat in your daily diet. Since vitamin B12 is only found in animal-based foods, vegetarians may need to take dietary supplements. 6. Sulfur. Sulfur helps accelerate the production of collagen and proteins, making it important to include sulfur-rich foods during the disc healing process. Sulfur is a crucial mineral for collagen production and can be found in cruciferous vegetables, arugula dairy products, eggs, and legumes. There are 3 main categories of sulfur-rich foods: allium vegetables such as leeks, garlic onions, scallions, and shallots; cruciferous vegetables like broccoli, Brussels sprouts, cabbage, cauliflower, the collard greens, kale, and watercress; animal-based foods such as bone broth, grass-fed beef, organic eggs, and wild-caught fish. What should people with herniated discs eat? 1. Foods rich in calcium. What should people with herniated discs eat? Calcium is a top essential nutrient that should never be missed in the daily diet. It is a mineral that plays an important role in the formation and development of bones. Foods rich in calcium are especially necessary for patients during the treatment and recovery process of herniated discs. Calcium is an incredibly important substance indispensable for the development of bones and joints. Due to aging, labor, or other factors, calcium levels in the bones decrease. Lack of calcium can cause the bone structure to lose flexibility and become prone to degeneration. Therefore, supplementing the deficient calcium intake is very necessary. Although the intervertebral disc itself does not contain calcium in cases of herniated discs, the bones are also damaged. Calcium helps heal and strengthen the spinal bones, thereby reducing pressure on the discs and improving the condition. It is also important to know that the body needs sufficient vitamin D to absorb calcium better. The body can synthesize vitamin D naturally through exposure to sunlight. This mineral can be easily found in some calcium-rich foods such as dairy products like fresh milk, yogurt, cheese, dark green vegetables like kale, spinach, broccoli, beans such as tofu peas, black beans, certain fish like salmon and sardines, other foods like tofu, sesame seeds, cornmeal, brown sugar. Patients should also combine calcium intake with other nutrient groups to maximize effectiveness. 2. Glucosamine and chondroitin. Amino acids participate in the formation of cartilage and connective tissues. Among them, glucosamine and chondroitin are the 2 most important components. Patients can supplement these through some foods such as beef, chicken, lamb, fish, milk, peanuts, almonds, eggs, cabbage, soybeans, and green leafy vegetables. These are important compounds that help create the cartilage matrix. You can find these natural compounds in bone broth or ribs from cows and goats. In fact, glucosamine is a type of glucose but has been proven to slow the degeneration of spinal discs better than general glucose. Therefore, foods containing these nutrients are recommended in the diet of herniated disc patients. Glucosamine is found most abundantly in shrimp or other crustaceans and bone broth. Consult your doctor before using supplements, especially if you have a history of allergies to medicines or supplements. Though a type of glucosamine supplements do not affect insulin absorption or insulin efficacy, so diabetic patients can still use them. Additionally, supplementing glucosamine and chondroitin via functional products is necessary, especially for the elderly who have poor absorption. It is advisable to choose fine-form products for easier absorption. There are many products on the market containing these active substances with various origins and prices. Patients or caregivers should carefully research and consult doctors to choose reputable, suitable products. Glucosamine must be used properly to maximize its effects. 3. Foods rich in glucose. This group provides a direct energy source for the body, like fuel for an engine. The body uses glucose to generate energy for cellular functions, daily activities like sports, reading, or even resting. Studies also show that this nutrient significantly helps the healing process and promotes self-repair of damaged spinal discs. Therefore, glucose is one of the first nutrients to supplement in this diet. Glucose is found in many foods, but it is best to choose natural and healthy sources such as fruits, cereals, whole wheat bread, whole grains, etc. 4. Plant-based protein. Plant protein has been proven to offer more health benefits than animal protein. It is an important nutrient good for bones, joints, and spine health, reducing inflammation or preventing the worsening of herniated disc symptoms. Patients can consider adding peas, lentils, chia seeds, mushrooms, etc. to their daily meals to ensure adequate protein intake. 5. Dark green leafy vegetables. Dark green leafy vegetables are rich in calcium and very beneficial for treatment and recovery of herniated discs. Examples include kale, mustard greens, watercress, especially good for bone and spine health. These vegetables also contain a high amount of vitamin K2, which helps maintain bone minerals by transporting calcium from tissues to bones. The combination of these two nutrients also strengthens the bones in the spine and the entire body. Vitamin K1 found in some vegetables can convert to vitamin K2 thanks to gut bacteria. 6. Salmon. Patients should add salmon to their daily diet if they wonder what to eat for herniated discs. This food is rich in omega-3 fatty acids, which help reduce inflammation, support disc regeneration, and significantly improve back pain symptoms. Alpha-linolenic acid contributes the most to spinal health. This compound is also found in many vegetable oils, most fish and seafood. Besides beneficial fatty acids, salmon is also rich in vitamin D, which participates in the treatment and recovery of herniated discs. 7. Milk and dairy products. Milk and dairy products contain large amounts of calcium and minerals, playing a crucial role in bone development, including size, mass, length, and strength. Patients should prioritize yogurt and cheese as they provide up to 42% of the daily calcium requirement. 8. Fresh fruits. Fresh fruits, especially berries, contain abundant antioxidants, vitamins and minerals directly involved in the healing process. Vitamin C in oranges, tangerines, and grapefruits stimulates collagen production for spinal discs, strengthens bones, and effectively fights infections. This also supports the immune system, reduces back pain, and ensures uninterrupted spinal recovery. On average, every 100 grams of orange provides about 50 milligrams of vitamin C, which is about 56% of the recommended daily intake for adults. Supplementing vitamin C helps reduce inflammation and stimulates collagen production, maintaining a strong spine against the harmful effects of herniated discs. 9. Turmeric. Turmeric has anti-inflammatory properties that effectively relieve back pain and arthritis. Its curcumin component is a powerful antioxidant, offering many benefits for herniated disc conditions and overall health. Patients can use turmeric in various forms as a spice powder or capsule. Curcumin has been proven to inhibit the activity of inflammatory mediators, preventing and stopping the spread of inflammation. It affects many inflamed areas in the body, including arthritis, intestinal inflammation, atherosclerosis, etc. Thus, absorbing curcumin not only controls damage in the fibrous ring of the disc, but also helps patients improve and maintain overall health. 10. Avocado. The potassium and healthy fats in avocados help improve overall health and significantly reduce cholesterol. Vitamin C content also brings many positive effects for the spine. Alongside fatty fish, avocado is a rich source of omega-3, helping patients control weight, reduce pressure on discs, and avoid swelling and inflammation of bones, joints, and nerves. Additionally, avocado contains a relatively high amount of vitamin D, optimizing calcium absorption and usage, helping bones stay strong longer and aiding in healing herniated disc injuries. Therefore, this is a necessary food patients should add to their daily meals. 11. Omega-3 fatty acids. Once in the body, omega-3 fatty acids convert into prostaglandins, playing an important role in anti-inflammatory responses. Hence, people with herniated discs should consume many omega-rich foods. Research shows omega-3 fatty acids naturally reduce body inflammation. While some inflammation is needed for healing, excessive or chronic inflammation causes damage. Supplementing omega-3 helps reduce chronic inflammation, which is a common cause of back pain, thus reducing the pain. Omega-3 fatty acids help prevent cartilage and disc damage caused by inflammation and may help repair existing damage. Foods rich in omega-3 include cold water fish, mackerel, salmon, tuna, nuts, walnuts, almonds, soybeans, macadamia nuts, bone broth, veal cartilage, beef cartilage. These contain glucosamine chondroitin and calcium, which strengthen cartilage and reduce swelling. Dark green vegetables rich in vitamins, ACK and minerals like iron and calcium, essential for bone health, reducing osteoporosis risk, and lowering the chance of cancers such as breast and stomach cancer. Examples include spinach, mustard, greens, kale, cabbage, broccoli, and sprouts. Omega-3 fatty acids are highly concentrated in fish oil, an excellent anti-inflammatory component. Omega-3 supplementation via fish oil or functional foods is also an option. 12. Walnut nuts. People with herniated discs often face a high risk of nervous system damage. Omega-3 from walnuts has been shown to improve severe nervous system injuries, helping patients prevent serious neurological complications. Walnuts are also a rich protein source that stimulates muscle cell production and maintains vertebral strength. Adding this food to the diet can soothe nerve pain and numbness caused by nerve compression and support effective treatment. 13. Eggs. Besides protein, vitamin D and calcium, eggs are rich in vitamin B12, which benefits the spinal nervous system. Disc compression can damage spinal nerves, causing numbness and pain in the lower back, radiating downwards. Supplementing vitamin B12 from eggs helps regenerate spinal nerve cells, ease pain, and protect patients from paralysis or muscle atrophy in the lower limbs. 14. Green tea. Green tea is a rich source of antioxidants, including vitamin C, E-catecholic quercetin, especially EGCG. Drinking 1 to 2 cups a day may help control inflammation and damage in the disc's fibrous ring joints and nerves. However, because caffeine in green tea may inhibit nutrient absorption, it is best to drink it 2 hours before or after meals. 15. Algae and seaweed. Algae and seaweed contain relatively high amounts of calcium and magnesium, helping improve bone density and making bones more flexible and strong. They also contain glucosamine, a compound proven to protect patients from disc degeneration. Thus, including algae and seaweed in the daily diet can be an effective solution to optimize herniated disc treatment. What should patients with herniated discs avoid eating? Besides beneficial foods, patients should also know what to avoid in order to create a reasonable diet plan. To reduce pain and inflammation effectively, people with herniated discs need to limit or eliminate the following foods from their daily meals. Here are some items to avoid. 1. Refined carbohydrates. Foods containing refined carbohydrates, such as cookies, pastries, French fries, white bread, and pasta, lack significant nutrients and can harm the body. Refined carbohydrates like white rice, white noodles, and white bread often contain high amounts of sugar and low amounts of fiber, vitamins, B and C, etc. Therefore, they can make weight management difficult for patients, create conditions for inflamed areas to worsen, and hinder herniated disc treatment. To reduce this, you should switch to complex carbohydrates from whole grains such as brown rice, whole wheat bread, oats and wheat, candy, refined sugar. Soft drinks and sweets contain high amounts of refined sugars and are the first foods to avoid. Excess sugar intake increases disc inflammation. Moreover, uncontrolled weight gain increases pressure on the discs and worsens the condition, specifically causes inflammation, making herniated discs more severe. High calorie content leads to obesity, increasing pressure on bones and joints, making recovery difficult. Contains many preservatives and flavor enhancers, worsening back pain. 2. Whole milk and full-fat dairy products. These foods contain saturated fats that can cause inflammation. Inflammation reactions are often more severe in people who are lactose intolerant. This hinders the treatment and recovery process of herniated discs and may worsen the condition. 3. Foods rich in purines and red meats. These foods contain high levels of saturated fat and uric acid, which increase inflammation and are bad for discs. Consuming these foods also raises the risk of cardiovascular disease, high blood pressure, and other health issues. Red meat provides abundant protein, but patients with herniated discs should limit daily intake. This is because red meat contains a substance called U5GC, which can worsen inflammatory responses. Red meats include beef, pork, lamb, and usually contain high levels of saturated fat. This fat can cause overweight, obesity, stimulate inflammatory agents, and increase the risk of severe complications in herniated disc patients. Therefore, patients should limit red meat consumption and switch to healthier protein sources like chicken, fish, or legumes. 4. Fast foods, high in oil and fat. Fast foods such as fried chicken, grilled meats, sausages, and French fries not only cause weight gain an increased pressure on the spine, but also lead to calcium deficiency, weakening bones, and increasing pain intensity. Oils and fats raise blood cholesterol, fostering inflammatory agents' activity. Frequent consumption worsens herniated disc conditions and increases the risk of fatty liver, cardiovascular diseases, gout, etc. Patients should choose as natural foods as possible. Processed foods with many chemicals, although convenient and flavorful, are harmful to health and can block self-healing in herniated discs. Fried and spicy foods can also worsen inflammation in herniated disc symptoms. Limit foods like fried chicken and spicy curry. Try grilling instead of frying and choose milder spices like turmeric and dill. A healthy diet plays an important role in controlling lumbar herniated discs. Applying a diet low in sugar, milk, fried, and processed foods effectively reduces inflammation and pain. To maximize benefits, seek guidance from nutritionists or therapists to build an optimized meal plan supporting spinal health. Note that vitamin and mineral supplements outside of food should follow doctor's instructions. With proper diet and interventions such as orthotic care and physical therapy, you can control lumbar herniated discs and live a better quality life. 5. Refined grains. Refined grains, white bread or pizza, contain high amounts of starch which can spike insulin and cause joint inflammation. Replace refined grains with whole grains or foods made from whole grains. 6. Foods likely to cause weight gain. High in sugar people with herniated discs should avoid foods high in sugar. Sweet foods like candy jams and sodas can stimulate inflammatory agents and increase the risk of overweight and obesity, putting more pressure on the discs. Regular intake of sugary foods worsens herniated disc conditions. White bread, pasta, full-fat milk, and snacks also cause rapid weight gain and are harmful to bones and joints. 7. Alcoholic and stimulant. Beverages. Alcohol, beer, cigarettes, and other stimulants are harmful to health and negatively affect the treatment process. Hydrogenated vegetable oils increase obesity risk and accelerate spinal degeneration. Nutritional adjustments alongside treatment are important for effective herniated disc care. Currently, most patients benefit from chiropractic therapy combined with physical therapy in modern devices such as DTS spinal decompression machines and ATM2 active rehabilitation devices. This therapy has been successfully applied for many conditions, not only for pain relief, but also for maintaining long-term vitality and health. What should people with herniated discs drink? Water is essential for the hydration process needed to heal degenerated discs. Plant-based milk, choice milk, so walnut milk, mung bean, and lotus seed milk are considered good sources of calcium for bone and joint health. Vitamin C-rich fruit juices. Patients can drink orange, grapefruit, lemon juices, etc. to vary their taste. Tea. Certain teas such as green tea and cinnamon honey tea have pain-relieving anti-inflammatory effects and help improve blood circulation. What should people with herniated discs avoid drinking? Alcoholic and stimulant beverages like alcohol, beer, cigarettes, and caffeine significantly reduce calcium and mineral levels in the body, increasing the risk of bone and joint pain. Knowing what to eat and avoid helps patients with herniated discs have a smoother treatment process and avoid health risks. Preventing herniated discs. Some notes to help restore herniated disc function. From the causes and risk factors shared above, we know that herniated discs cannot be completely prevented, but the risk can be reduced. The condition can be prevented by applying the following measures. Maintain a healthy weight. A reasonable weight not only helps you have a slim figure, but also prevents many diseases, including herniated discs. If you are overweight or obese, you should seriously consider losing weight now. Exercise regularly. Moderate exercise, at least 30 minutes a day, helps strengthen and increase endurance of muscle groups, thereby stabilizing the spine and reducing disc damage. Maintaining a regular sports routine can support musculoskeletal health and protect patients from the negative effects of herniated discs. Suitable sports for patients include swimming, walking, and cycling. Move with correct posture. Performing movements with proper posture, such as keeping your back and neck straight while working, avoiding sudden bending when lifting heavy objects, and not shaking or twisting your neck, reduces pressure on the spine and discs. Standing, sitting, and lying in correct postures minimize spinal injuries and optimize disc recovery. When standing or sitting, keep your back straight, chest and shoulders comfortably open. Remember to stretch and change posture every 30 minutes. When sleeping, prioritize lying on your back or side rather than on your stomach. Avoid smoking stimulants and limit alcohol. Tobacco is the enemy of health. Quitting smoking as soon as possible helps maintain a healthy body with flexible bones and joints. Patients with herniated discs should avoid alcohol and limit its consumption as it can interfere with treatment. High alcohol content can inhibit the body's calcium absorption and accelerate inflammation. Rest when experiencing spinal pain. The spine can become sore when overworked or after excessive activity. In such cases, complete rest is recommended to allow the spine and discs to recover. Follow a scientific diet. Supplement calcium, vitamin D, and nutrients that nourish healthy joints. Regular health checkups. Every 6 months or immediately visit a healthcare facility if experiencing unusual symptoms like pain, numbness in the buttocks, thighs, legs, difficulty urinating, or sudden weakness in limbs. Limit heavy lifting. Patients undergoing treatment and recovery should avoid carrying heavy objects. If necessary, instead of bending at the waist, squat down, hold the object with both hands, keep your back straight, and use your legs to lift. Manage psychological stress. Prolonged stress can cause muscle and ligament tension, putting pressure on the spine. Patients should practice relaxation techniques like yoga and mindfulness meditation to relieve stress and maintain a comfortable mood. Supplement essential nutrients for bones and joints. Nutrition is the foundation for building and maintaining a strong musculoskeletal system. Besides a balanced daily diet, you should actively supplement specialized spinal nutrients such as eggshell membrane, undenatured type 2 collagen, and collagen peptides, turmeric root, chondroitin, sulfate found in new generation products like Jex. These compounds are essential for supporting the healing and regeneration of bone and joint tissues, helping slow down degeneration. A strong, flexible spine reduces pressure on discs, effectively preventing herniated discs. One practical point in managing herniated discs and musculoskeletal diseases is early medical examination. Detecting disc herniation early while the annulus fibrosus is still intact and the nucleus pulposus has not severely deformed allows doctors to timely implement rescue plans to prevent worsening, preserving the disc and spinal structure.